Hi, my name is Laura Koski of eMedical Urgent Care located in Berkeley Heights, New Jersey. I'm sitting with Dr. Vincent Eletto today, and we're going to be discussing autism. How are you, Dr. Eletto?
I'm good, and how are you today?
Good. Autism seems to be really prevalent in the news lately, specifically with children. Are there any common signs of autism?
Well, there's autism. It ranges from mild to severe. There's typically three areas that we find in autism. It's the verbal and nonverbal communication, there's social awareness and interactions, and there's imaginative play.
How common is autism?
Actually, autism is found 1 in 68 children in the United States, and even higher in New Jersey, 1 in every 45.
Wow. Is there any course of treatment or cure for autism?
There is no cure for autism. What you have to do is find what their coping mechanisms are so that they become comfortable and they function as ordinary citizens to the best of their ability.
What is eMedical Urgent Care doing to help treat these patients?
Well, you know, we know that lots of times seeing a stranger, they become uncomfortable, they seclude themselves, and what we try to do is to bring them outside of that to provide a comfortable area for them to be treated.
Perfect. I see that you have this iPad here.
Yes.
How does this help patients with autism communicate?
Well, for instance, we have the pain scale up here, and they can simply come up to the pain scale and they can show us exactly what's going on. The 0 being the no hurt, the 5 hurts the worst. If they're not going to communicate with us, we can ask them, we can show this to them, they can point to it. For instance, if they have a sore throat, and it says sore throat. If they have a pain in their toes, they point to that. So it's really, you know, something where we don't have to sit there and try to drag it out of them. If they feel comfortable communicating like this, they will.
That's great. And I understand that eMedical Urgent Care actually has a room that is designated for patients with autism. So if they have sensitivity to light, we can dim the lights.
Yes, and if they like soft objects, we have soft objects for them. If they feel comfortable with a hard object, we have a hard object. If they feel comfortable with noise, we have things to make noise.
And I understand that these things in the sensory box, they can actually take home with them. Is that correct?
That's correct.
That's great.
And if they, we want to know, for instance, how do they like to communicate? Well, we give them this iPad, and they like to communicate with their iPad, or they prefer to talk to us. They prefer to communicate by typing. So they have a large variety of ways to go ahead, and we can bring them out of their shell, so to speak.
It seems like eMedical Urgent Care is really doing a lot to tailor to these patients.
Actually, EMA has been working on this for many years, and quite a few institutions use it. Columbia uses it, Barnabas is using it, and we continue to keep expanding on it.
That's great. Thank you so much for taking your time out to talk with me today. I really appreciate it.
Oh no, it's a pleasure. Always a pleasure.